Traditional intravenous and oral medications provide for very short-term therapy. And drug implants provide for long-term therapy over the course of months. Insitu Biologics is focused on that missing middle, that area in between where we want to deliver medication that will provide delivery over 3 days, 4 days, up to a few weeks. We have developed a prolonged delivery matrix that includes lipids, hydrogels, and microparticles. They can elute medication over 10 hours, 10 days, or 10 weeks. Our first product is a long-acting local anesthetic that will allow you, when it's injected around a nerve, to have 6 complete days of pain relief following painful surgery. This this platform is amenable and tunable for various medications as well. We are well on our way in our product pipeline development, beginning first with pain and then with cancer, infection, and inflammation. And as you can see, these markets are enormous. Imagine a world where pain relief is measured in hours, is not measured in hours, but is measured in days, where pain relief is done without opioid side effects and no risk of addiction. Imagine a world where cancer can be treated locally in a prolonged fashion without systemic administration of medicine and without systemic side effects. And how about treating antibiotics and inflammation at the source? Well, that's the world that Insitu's clinicians, scientists, and executives are building. We have finalized our formulation. We have 23 patents. We have an expedited FDA pathway, clear reimbursement. Our markets are increasing, and we cross all stakeholders and bring them all together, patients, families, clinicians, hospitals, as well as insurers and governments. We've raised $16 million to date and are just launching a B round to raise $4.5 million. Thank you.
Thank you. Excellent presentation. I have one question. So was it lipid, hydrogel, and nanoparticle? Is that all part of one treatment, or are those 3 separate modalities?
So the matrix, it's one treatment. So all of those components each hold a piece of the medication. And as you can imagine, each have various elution characteristics.
So beyond the 6 days, is the intent that the other modalities would take over for the previous? And is there, I guess a follow-on to that would be, is there a means of treatment or a thought for treatment if the initial pain treatment does not take? So beyond the 6 days, if patients continue to have pain?
So think of it this way, in that one of the components will give you a curve, a pharmacokinetic curve like this. The next one kicks in a few days later, and the next one perhaps days or weeks later. And it's all tunable by altering the combination and the consistency of the matrix.
Thank you. Nice presentation. Your Series B, can you just high level for us what your plans are with that money?
Sure. The Series B gets us through GLP studies and gets us through our phase 1 human trial.
Can you talk a little bit more from an FDA regulatory standpoint? You talked about the fine tuning of the different timescales. Does that require a different submission for each one of those?
It will certainly require a different submission for different applications. But within the, we've finalized the formulation for the local anesthetic application. And so that will be a single filing. And then, of course, for other drugs down the road, we would have additional filings.
One last question. Do you envision that for the local anesthetic, is this an intraoperative application? Is it an acute application or a chronic application?
So excellent question. So it can be administered any time, either pre-operatively or post-operatively. We've built into the pharmacokinetics of the local anesthetic enough local anesthetic burst of activity so that you could have surgical anesthesia. So you could have a nerve block that would give you enough pain relief so you would be able to not have a general anesthetic. And then the pain relief over time elutes out with different curves, and that gives you the prolonged duration of action.
Here we go. So what happens if a patient has an adverse reaction to the medication?
So, well, first of all, I won't speak to all of the cancer or other types of medications down the road. But with local anesthetics, there are very few allergic reactions to true local anesthetics. Your point is very good that if we're putting a larger dose in a vehicle, it's going to elute out over time. And that's a question that, of course, we're going to have to deal with. But in our initial work with the FDA so far, and with our animal work, we've shown that we've got pharmacokinetic curves that are really quite low compared to the native drug by itself. So theoretically, we may have a prolonged exposure, but it's going to be much less.
Is there a way to remove the local components somehow?
Most likely not once they're in place.
Okay, thank you.